choosing a healthcare facility, it can feel like a huge leap of faith, can't it?
Oh, absolutely.
Yeah.
You're putting your health, your well-being in someone else's hands.
The stakes are just incredibly high. So how do you get past that, hope and maybe anxiety to actually know you're making a solid choice?
That's really what we're digging into today, this deep dive. It's specifically for you, the listener. We've tried to cut through the noise.
Yeah, simplify it.
Exactly. To give you a clear path, some real tools to confidently figure out if a hospital or clinic you're considering is trustworthy.
Right. And to get there, we've looked at some heavy hitters in healthcare quality, like Joint Commission International, JCI, we'll call them. They're a big global name.
Yep, the global authority.
And the National Accreditation Board for Hospitals and Healthcare Providers, NABH, setting those high standards right here in India.
Right. And we also pulled insights from healthcare consultants HospiMatch for their strategic view.
The American Board of Physician Specialties on Professional Standards.
And just general best practices for how you can check out these facilities.
So our mission today,
it's really to arm you with practical steps, key things to look for so you can feel confident assessing these places.
You'll know what makes a place trustworthy.
That's the goal. A much clearer picture by the end of this.
Okay, so let's say you're starting out. You've got a name, maybe from your doctor, or you're just searching online. Where do you even begin trying to sort the good from the, maybe not so good?
I think the foundation really is understanding accreditation and licensing.
Okay, what's the difference?
Well, think of licensing as the absolute baseline. It's the legal permission to operate, meeting minimum state or local rules.
Just the basics.
Just the basics. Accreditation, on the other hand, through bodies like JCI or NABH, that's usually voluntary.
Voluntary. Interesting.
Yeah, it's like the facility is actively saying, look, we're not just meeting the minimum, we're aiming for excellence, we're committed to higher standards of patient care and safety.
Okay. So accreditation signals that extra effort, that commitment to quality.
Precisely. JCI, for instance, it's recognized all over the world, accredited over 1,000 programs in, 70-plus countries?
Wow.
And getting that JCI or NABH seal, it's not just a badge. It means the facility is constantly measuring itself against tough standards, always trying to improve how they care for you.
And NABH is the Indian equivalent.
Essentially, yes. It's part of the Quality Council of India, fully independent, and provides that reliable benchmark specifically for hospitals here.
Okay, that makes sense. But what does JCI accreditation say actually do for a hospital? How does it affect, the care you receive?
Well, JCI points out quite a few benefits. It really encourages this culture of always improving.
Right.
It helps them spot and reduce risks before things go wrong, streamline how they do things.
Makes sense.
Efficiency.
Yeah, plus it connects them to, a global network, sharing best practices. It boosts their reputation, helps attract top doctors and nurses.
And I saw something about JCI Continuous. Oh, yeah, that's interesting. It's a newer model. Seems like it focuses on more regular check-ins, continuous improvement, rather than just, one big review every few years.
So it's about always getting better, not just passing a test now and then.
Exactly.
But going back to that basic permission clip, the license, that's still essential, right?
Absolutely fundamental. State and local licensing ensures they meet those minimum safety and operational requirements to even open their doors.
Got it.
And, the NIH points out that checking for accreditation with bodies like the Joint Commission, that's the U.S.-based one, used to be called TJC, is a really good way to verify credibility.
Okay.
And it's worth mentioning, JCI even offers specialized certifications now, like for healthcare sustainability or telehealth. Shows how standards are evolving.
Adapting to new needs. Okay, so we've got licensing as the floor, accreditation as that commitment to go higher. Now, most of us, we start online, right? We go to the hospital's website. What should we be looking for there?
Oh, the website can tell you a surprising amount. Sometimes by what it doesn't say, too. No. First, maybe glance at the web address itself. Is it a .gov, .edu, .org, or a .com? That gives you a little clue about their main purpose or affiliation.
Like a university hospital versus a private clinic.
Exactly. Then dive into the content. What's their mission statement? What do they say their values are? Look closely at the services they list.
And the staff.
Critically important. Check if they clearly list their doctors, their specialists. Are their credentials and experience easy to find? Good places are usually pretty open about this.
Makes sense. Transparency.
And actually, Supremedic's podcast, Lifelines, had a great tip. Look for those accreditation logos like NABH or JCI. displayed on the site.
Okay, see the logo.
But then, and this is key, takes the extra step, go to the official JCI or NABH website and actually verify that the accreditation is current. Don't just trust the logo on the hospital site.
Cross-reference it. Smart. What about patient reviews? Google Maps, Bracto, Just Dial? Are those useful? Or just noise?
Well, they can offer a glimpse, see what other patients experience. But yeah, you need a critical eye. Be a bit wary of reviews that are super generic, like great hospital with no details, or ones that are just glowing over the top positive. Sometimes those aren't quite real.
Right. Could be fake or incentivized, so look for specifics.
Look for specifics, look for patterns. Is everyone mentioning long wait times or really great nursing staff?
Yeah.
It's the trends that are often more telling than one single review.
Good point. And how they respond to complaints.
Oh, definitely look at that. If they respond to negative feedback thoughtfully and professionally, that can be a really good sign. Shows they're listening and trying to address issues.
Okay, moving beyond the website and reviews.
Yeah.
The actual people working there, hugely important. How can you check if the doctors, the nurses, are actually qualified?
This is so crucial. For doctors, there are official ways to check. In the U.S., the Federation of State Medical Boards has a tool called DocInfo, and you can usually check with individual state licensing boards too. See their credentials if there have been any disciplinary actions.
What about outside the U.S., like in India?
Supreme Medic points out that in India, it's actually a legal requirement for doctors to clearly display their degrees and qualifications within the clinic or hospital. Yeah. So look for that. Is it visible?
Okay, look for the framed degrees.
Yeah. And don't just focus on the doctors.
Right, the nurses, the specialists?
Exactly. Don't be shy about asking about the training and qualifications of the nursing staff. Are the specialists you might need actually full-time employees or just visiting consultants who might not be there when you need them? Supreme Medic really flags these as important questions to ask.
So be proactive?
Totally. When you call, or if you do an initial visit, ask directly. The patient's guide source we looked at suggests asking things like, is the hospital NABH accredited? Can I see a tariff list? Do you have in-house specialists for XYZ? Is there an insurance help desk?
Direct questions get direct answers. Hopefully.
Well, they give you valuable information either way.
Okay, now imagine you're actually at the facility, maybe for a consultation or just checking it out. What tangible things you can see and feel, build trust?
Cleanliness. It sounds basic, but it's fundamental.
Absolutely.
Supreme Medic stresses this good hygiene isn't a luxury, it's essential for safety. Is the place visibly clean? Maintained?
What else?
Billing practices. Pay really close attention here. Transparency is everything.
How so?
Are there charges displayed somewhere? Do they give you clear, detailed, printed receipts for everything? Do they readily accept your insurance or explain payment options clearly?
No hidden fees, no surprises.
Exactly. And the patient's guide adds, make sure the bill breaks down all the charges properly. It should be itemized and include necessary taxes like GST or service tax correctly.
These seem like reasonable expectations, but I guess a lack of them would be a red flag.
Definitely. And speaking of red flags, sometimes you just get a bad feeling, right? Trust your gut.
What specific things should make us pause, though?
Well, pulling from Supreme Medic and the patient's guides, some definite warning signs would be no visible registration information for the facility itself, or you can't easily find out the name of the doctor in charge.
Okay. Lack of transparency again.
Yeah. If the place just looks dirty or neglected, if the staff seem untrained, unsure, or are just plain rude.
Big red flag.
Huge. Also, any kind of pushiness around billing, especially demands for large cash payments up front without clear explanation. If they're vague about who will actually be treating you.
Or if they won't give you cost estimates.
Exactly. Reluctance to provide estimates or hesitation to give you copies of your own medical records. Major red flags. And maybe keep an ear out for high staff turnover, especially doctors. If lots of doctors seem to leave quickly, that might indicate underlying problems.
Wow, that's a really practical list of things to watch out for. Okay, let's flip this around. What can the hospitals and clinics themselves do? How can they actively build that trust with us, the patients?
That's a great question. The American Board of Physician Specialties, ABPS, really emphasizes that trust is like the absolute foundation of the relationship.
Makes sense.
And it's not just about feeling good. When you trust your healthcare team, you're much more likely to actually follow the treatment plan.
And get better results.
Exactly. Better health outcomes are directly linked to trust.
So how do they build it? What actions can they take?
Hospitals can be proactive. Displaying information clearly is a big one. Info about their doctors, their credentials, definitely their accreditations.
Put it out there.
Put it out there. Maybe even share data on patient safety measures or their success rates for certain procedures if possible. Transparency helps.
What else?
Following through. Doing what they say they'll do. Communicating clearly and honestly. Especially if things don't go perfectly.
Owning mistakes.
Or just keeping you informed. Being transparent about costs, treatments, everything. And fundamentally making you feel valued, respected, listened to.
It sounds simple, but probably hard to do consistently.
It takes effort, for sure. But ABPS makes the point that if that trust isn't there, you, the patient, are likely just going to go somewhere else. And you should.
Absolutely. Okay, this has been incredibly thorough. If we were to boil it all down, what are the absolute key takeaways for someone trying to evaluate a hospital or clinic?
I think the main thing is be an active, informed participant. Don't just passively accept.
Take charge.
Yeah. Check for those basics.
Yeah.
The license to operate and ideally that extra layer of accreditation from a body like JCI or NABH.
Do online.
Dig online, look at their website critically, check those staff credentials, see how they handle patient feedback, verify any accreditation claims.
Ask questions.
Don't hesitate. Ask about the doctors, the nurses, the specialists, the costs, the insurance process.
And when you're there,
use your eyes. Check for cleanliness. Demand transparency in billing detailed bills, clear charges.
So really, being an informed patient means taking these concrete steps. It leads to safer choices.
It really does. Always take that extra moment to verify before you fully trust. Think of these steps we've discussed as tools. Tools that empower you to make better, safer decisions about your health.
That's a great way to put it. This deep dive has given us, and hopefully you, a really solid framework. It underscores why we can't just take things at face value in healthcare. We need to investigate, ask those questions.
Be critical in a good way.
Yeah. It's a starting point, isn't it, for becoming a more engaged, more critical thinker when it comes to choosing who we trust with something so vital.